Good morning again, and welcome all of you to this session for today. We're gonna talk this morning on the thematic that has been mentioned lots of times during these past days because this theme is very pressing in the region, and it's the topic of human mobility in the region of Latin America and the Caribbean. We know that millions of people in the region are moving because of armed violence and conflicts, climatic disasters, economic reasons, social reasons. Hanik presented some data on this pressure at the global level and how that affects children. They are looking for safe refuge and this upkeeping and safekeeping of their children's lives. And we also mentioned that this phenomenon has structural causes and proportions are alarming, and that is why it's important, so important in these days to be talking about that, all of us as humanitarian actors, especially for children. Data to complement what was mentioned in the previous days. According to uh, IOM, the flow of in-transit migrant people through Central America has multiplied by 3 since 2022 and 2023, and the mean stay has increased as well. Over half a million people have crossed the Darien Gap during 2023. Just during the last quarter of last year, this first quarter of this year, over 100,000 people, including a lot of boys and girls. And we know a lot of people lose their lives during that track. In Honduras, those who are crossing tripled according to the local migration figures. And in Mexico, data from IOM, there was an increase of 77% of irregular migration during last year. And then you had the Venezuelan crisis, 7.7 million Venezuelans that left their own country since 2017, of whom very close to 50% are children, boys, girls, and adolescents. We know that the most safe routes are closing, compelling people to take very risky routes. Among these people, we know very well that there are a lot of families accompanied by boys, girls, and adolescents of every age, single mothers with their children, and unaccompanied or separated minors, of course, due to the causes that they are facing along the way. The UN project Migrantes Desaparecidos, missing migrants, at least 1,200 people died or disappeared during migration in the Americas during last year. So these are very shocking numbers. The last piece of data that I want to mention is the one about Doctors Without Borders, that it registered an increase last year, 7 times of monthly events of sexual violence, both in Mexico and Central America. And we know usually this happens to girls and adolescents, but also boys. They are victims of violence as well. We know that the impact of this crisis, this humanitarian crisis of human mobility, affects them physically and emotionally, both boys, girls, and adolescents. It's devastating. Long-term consequences are disturbing, and among some of this violence or abuse that they face, these girls, boys, their families, is physical violence, sexual violence, gender-based violence, kidnappings, extortion, discrimination, xenophobia, human trafficking, abuse of power during many different stages during the migratory process from the countries of origin as well, and sometimes during their journey. These violations oftentimes happen with full impunity because they are facing the vulnerability of these families, of these children. They may not have safeguarding or they don't have an adequate protection for their age and stage in development. We know that barriers to access to service are big, lack of clear information. We have been mentioning this lately, and especially how to access these services. These are one of the multiple barriers. I know oftentimes you work with some of these. So we're facing a crisis that compels all of us to act as humanitarian actors and with our partners. Organizations are responding, like Shiman was saying yesterday during the opening of this event, trying to address the most in need. There's a difficulty to tackle demand and facing many different challenges. There's a population in constant movement, those who are changing frequently as well. Today we wanted to talk in particular about a way of a response, those that are considered the bare minimum norms of safeguarding is the blocking data. It reminds us of the importance of prioritizing comprehensive approaches between sectors in this response. And also, it has been mentioned, paying attention in the different responses that we heard yesterday from Javi, Shima, etc. A response that is centering boys, girls, and adolescents that are having specific and diverse needs according to the phase that they are going through, working effectively between sectors to become more efficacious in addressing those needs, contributing during different developmental stages of this.
El uso de los recursos que sabemos ser más y más
Many organizations represented here that are working directly with children during emergency.
World Vision, entre otras que van a hablar.
That UNICEF Vision and some others that are going to present today. We are helping, allowing different actors to join forces to reach common objectives instead of competing with each other, as we mentioned yesterday. Today's discussion is trying to explore some of those approaches of comprehensive responses, intersectoral responses, understanding how we're working to respond to these multiple needs, which are the challenges that we know are present and sometimes are structural. Sometimes the institutions are not connected to the crisis per se. So we need to understand this. And also, which are the achievements that are along the way. I am a technical consultant for children in cases of emergency, and with my colleague Miragolda, regional consultant for the protection of children for the Lacaro region. We're going to be facilitating this panel. And before I pass the floor to Neri, and she's going to present or introduce our great panelists, I'd like to ask you that we do a little activity before we begin. So please bring out your cell phone, and we're going to ask a question to open the session. and then passing the floor to the panelists. So the question is, what words come to mind when you think about the needs of children and adolescents on the migration route? Okay, this is really just to align ourselves into what we're talking about and about whom we're talking about, even though we don't have present a boy or a girl with us right now, but we want to be feeling close to them. So I'll pass the floor to Nettie. She will introduce our panelists and we'll begin our discussion in earnest then. Thank you so much. We know we are slightly behind schedule. We have 3 sessions, and the idea is to be able to talk about 3 questions. As Lavinia was saying, block 4, and you'll find a framework of cross-sectionality in these programs. In these sessions, we can talk a little bit about comprehensive planning. These are the names of our panelists. I work for the Chipre office. Ana Catalina Fernandez, she's our protection specialist for children from UNICEF. For over 15 years, she has worked in the region and working with other NGOs. Thank you. Let's receive her with a round of applause. We also have Lauren Lynn. During this process, we have getting to know each other. She works for World Vision, and she's been working for over 20 years, working in topics of child protection, 10 years with the state, and another 10 with an NGO, World Vision Honduras. So let's receive her with a warm round of applause. Oh, she has her own cheerleaders. That's good. And we also have Mónica Cervantes. Mónica Cervantes. She's from Mexico. She works for the Office for Save the Children Mexico. And you see her really very young looking, but she has been working for many, many years. She has a lot of experience in talking about migration topics. So she's our specialist in a response to migration in Mexico. We will have 3 questions, and the intention is that not only they should answer, but you can question yourself what's going on in your organizations through your experience. Try to address those questions, make sure that they make sense. So each of our panelists will have only 3 minutes to respond each of these 3 questions. With Lavinia, begin the timer so we can do this in record time. How are you responding to the needs of children and families and adolescents on the move in a multisectorial manner, and what gaps have you identified? How are we responding to the needs of children, boys and girls, in a multisectorial manner, and what gaps have you identified?
Empezar, ¿verdad?
Gracias.
A nivel de países y luego vamos a escuchar una respuesta, ¿verdad?
So we will hear a more regionalized response.
A todas y todos.
Thank you, Neri. Thank you all of you. It's a pleasure to be present here today, to be able to share Mexico's experience and the work we have done with Save the Children Mexico and the important challenges that Lavinia was describing with laser focused attention. and adolescents and their families too. This is very challenging, facing the multiple needs that we have identified and more in the Mexican case.
Ustedes saben, y si no, pues vale
And as you know, and if not, it's good to remind you,
el principal destino de los flujos.
the interpreter apologizes. We're having some issues with the microphone volume. Let me continue. We have gone through many years in the learning of what has been the friendly or spaces, the friendly spaces modality has allowed us to foster this as a safe space in which boys, girls, and adolescents may have a very first contact with their peers after a journey in which they have been exposed to multiple risks and in situations of vulnerability. So this is the first moment in which after a long time they can coexist in a safe space with their peers, but also allows us to acquire in a direct manner with the educational sector, because this educational topic is a platform to approach different other topic matters influencing the other sectors, addressing the different needs. During these sessions of learning, evidently, there is a host of possibilities open, like health and nutrition. It goes hand in hand with the nutritional stage that we can provide these people, these children, in the spaces where they are sheltered. We also have the component of psycho-emotional support. These sessions also through different methodologies in learning to foster artistic or artistical development. The children retell the stories from their countries of origin, and it's very difficult to break with that. So we offer the opportunity to children to participate and also approaching in the multidisciplinary area for those who are offering the friendly spaces, which are again protection spaces. So we can come closer to these children and start to identify what's going on and offer some behaviors or look out for traits in their development.
Se van
We identify these cases, opening more and more the swath of the collaborative work with the other organizations and local actors. And maybe we can jump into more specialized actors' work, because maybe some of these people would need to receive more professional legal advice or jump into a more specialized educational platform. And we work on health, physical and mental health, etc. Up to now, this has worked very well, offering this protection using the educational platform to reach the other sectors of care. At least that's the Mexican experience. Thank you.
Bueno, muy buenos días.
Good morning. Thank you very much, Lavinia and Neri, for this accompaniment in during this process and to be part of the alliance, which has been very nice to meet and now to come together and share. Allow me to share a little bit of the context in Honduras. Honduras is a fragile context, not only because of violence, but it's also an environmental fragility. There has been an increase in mobility and mixed flows. During 2023, a total of 182,000 people were attended or assisted from more than 20 different nationalities. And as of today, 200,000 individuals have transited this national country, specifically in the northern area of the country. And without a doubt, they are exposed to different type of violence, such as violence, exploitation, sexual abuse, extortion. The locals have very little empathy, and they even bill them with very high prices. For example, if a bottle is $1, they increase the price to $20 for these migrants that are mobilizing or moving through the country. World Vision and its work is based in the community. They have strong coordination with the local stakeholders or actors such as the church and local governments. They also work with the Child Protection Department, which is the El Paraíso Council. They coordinate and plan how to create or raise awareness and advocacy. In fact, there was a tax that these individuals need to pay for around $20 per person. For example, if there was a family of four, each person would have to pay those $20 to $40. Many times they didn't have the money and they had to wait until they were able to collect the money, so they weren't able to transit or they would have to stay in the territory. So there's definitely a crisis. With this advocacy, we were able to remove the tax from the migrants, those people that were mobilized in the country. Regarding extortion, we started a joint campaign in order to raise awareness in the local actors. The campaign is called In My Country or In My Land, I Will Help You. This raises awareness at a local level to stop raising the prices of the different goods and products, along with other typical different type of actions to help people in their mobility. Of course, we work in coordination with humanitarian partners, which has been very relevant, specifically in the protection cluster in the center northern area. We have a close relationship with a total of 15 organizations. We all know exactly the work and tasks that they carried out in order to do not duplicate any efforts. We create this friendly environments and provide assistance. We identify and refer cases. All of the cases that are being referred, they provide services and assistance to vulnerable groups such as children and people with disabilities. Catherine, you're next. Thank you. Good morning. Thank you, colleagues from Honduras and Mexico, for providing these practical cases. From our regional vision and from UNICEF, I can say that without a doubt, we started with that integrated vision, like Lavinia just mentioned, and this must start from home. From UNICEF, we have watch sectors for nutrition and children protection areas. So it truly shows how we're able to better serve all of these different areas of opportunities and people that are in vulnerability. So we bring to the table this coordinated joint work in the identification or joint identification, all of the different sectors that require service. We raise awareness and we are advocates of child protection and how do the many risks that these children are exposed to may increase if there is a lack of basic services such as health or there is lack to nutrition or lodging. So how do we work in these needs? We have worked in identification of different multi-sectoral needs, including the protection of these children. This allows us to program jointly with other different organizations how to better serve and protect boys, girls, and adolescents. Later today, we're going to present an example at a regional level because we are linked at a sectorial area, but also at a regional level. Because as it was mentioned by Honduras, we serve them at a local level, but also at a regional level, understanding that the resources many times are limited. Our capacities are also limited, but we serve these children providing the protection. We work closely with education, general protection, and GBB with shelter areas. Another action, as Nettie just mentioned, we need to show what are the different gaps. The different gaps that we have identified is that the multi-sectoral benefits vary depending on the route. And the age of the individual that's going through this route. It's very different to speak about a boy, a girl, or an adolescent, or an adult that's crossing a specific area for 1, 2 hours during the day, or other areas or routes that they'll be moving for 2 to 3 weeks or even months. So their needs are different. The migratory routes and the stages and the ages is going to determine the number of services that they require. So we are working closely in how to provide better services to all of these individuals based on their routes. Thank you. Very well. Now let's move on to our second question. We just looked into the generics. Now let's have a deep dive. What are the main challenges identified in providing an integrated response? And how have you addressed this? Thank you. Thank you, Nettie, for this question. This is clearly linked with what Kata already started to mention. We must be able to guarantee that we're serving all of the diverse needs of boys, girls, and adolescents. Evidently, this requires a foundation and a very integrated work. It is impossible to move forward by ourselves or work in silos. If we truly want to provide integrated support, we must work as a whole. In our experience, we also work hand in hand with civil society. We have created spaces for shelters and areas from the civil society. They have worked as our strategic allies in order to provide the services. But then we move on with the complementary services, so all of the different sectors can come along and provide these services based on the needs that have been identified. The colleague from Honduras mentioned that they work with the public protection system or systems that are already available that serve as a agency of priority in order for us to work in an integrated manner. Within the context of Mexico, considering their strategic points or areas where we have intervention, it has been very important to work with the organizations that are already in the area and working in different contexts. Each and one of these organizations have their own strongholds and even their technical expertise. Reason why we come together, we complement the work and the response that we provide, and they're becoming more integrated. Some of the challenges that we see will always be access to resources. Normally, when we work with donors, they are, I would say, labeled or the resources are labeled based on their area of service. So the challenge has been to be advocates and to raise awareness, understanding that the provision of service should be comprehensive and not just limited or labeled to certain areas. So those are the different things that I can share from Mexico. Thank you very much. I'm going to share, I apologize, the challenges. One of them is a weak integration between the public sector and private enterprises. They see this topic as a threat. Why? Because this is a touristic area, so they perceive this mobilization topic as a threat. There is a weak response or very poor integration from the private sector and the public sector in terms of human mobilization. We have also identified other challenges from coyotes or quote unquote guides that provide accompaniment to these migrants. And by doing so, this interrupts the type of services that we provide, and they have also been aggressive toward those who provide service. Another challenge is to have officials that provide protection since we don't have their presence in many of the area. So we've been raising awareness and being an advocate of having that institutional presence from the law enforcement in different areas in order to provide that security that is required. There is very little coordination with the transport industry. There has been a high flow of individuals in the migration office. buses leave before the individuals receive the care and assistance. So we have that challenge with the transport industry. Another challenge is a limited access to basic services. Not only for the locals, but basic services and protection, health, educational services are very limited with the high flow of individuals that have this mobile that are going through these routes. This has become another of the many challenges. Got them? Something that was mentioned by the panelists, and I believe that it's key among the challenges, and it's very frequent in Latin America and the Caribbean, is that many times the capacity of human resource that we have in the areas in which the mobility happens is already a challenge. And not just that, but the way and how we work in other sectors in when identifying a child that has a risk of protection, we need to have that collaboration or that integration with other different sectors in order to refer and provide services to these children. Reason why we need it, we perceive a challenge in coming together in a way that we can integrate the services in the intersectorial manner. When we talk about child protection, we must also learn as to what is being carried out by other sectors in order to learn from them, obtain their lessons learned, and that way improve the services that we provide. I think these are one of the challenges. Another challenge is coordination. The multisectorial coordination in which many times we can be on site, call it during a transit phase or an origin or destination country or a host country or area, we're not working in coordination. And in our region, we call the non-victimizing re-victimizing the victim. However, what we do see is that we have many challenges in this area. Why? Because we're not working as a multi-sectorial manner. Another challenge is coming to work to and working together. How the different interventions that we provide, we see the lack of the integration in terms of protection in order to have a greater advocacy in this area. Thank you very much. With this, we're going to close with a final question. Now, this question talks about what are actions of impact or replicable actions? What good practices are we able to share or would like to share with the audience? But here, as we say here in Latin America, we're just going to flip the coin because we want to see what are the things we can do in order to improve and have a better, more positive impact in the type of work that we carry out and good practices. So we have a video that we would like to run. Could you kindly, in 1 minute, frame this video? Yes. Well, there are many people in the table that can also add a lot of this regional initiative. As I said, this is a regional initiative that we started in order to provide response to the Venezuelan migratory crisis. You're able to see in all the different support spaces considers minimum or basic services to in during this route, not only for the children and the adolescents, but also their families that at one single place they're able to receive minimum or basic services. The video provided information regarding that minimum basic services that are provided at the borders, and this is available in all of the different border points, specifically on the southern side of the Americas, where we have been working and we have been closely developing new efforts or working together. We have a different supports from Ecuador, where we have shelters at the borders and among other type of services. But it's not only the provision of services, but also coming together in coordination with all different actors. When we come together, we understand that it takes time in order to achieve this result in which we come together, we work together, we know exactly what services are provided by the different actors. But this also allows to strengthen the work that's provided in the community and allows the participation or engagement of the community itself. Very well. So let's adjust our time because we want to stick to our agenda. Could you kindly share a replicable action so that our colleagues can engage and listen to this? Yes, we have a mobile information system. We work together with ACNUR. This type of mobile information system provides clear information. We work directly with the UNHCR. So those people that are mobilizing or moving can protect their lives, their physical integrity, and receive service health and even humanitarian basic services. This mobile unit moves or to the different areas and the border areas, and they provide basic information. So when we are in a different country, it is very hard to get access to that basic information in order to for them to understand where to go to get services. For example, areas of or shelter, areas for resting, emergency contact information, financial assistance, and financial agencies, the printing of personal documents, and services such as Wi-Fi, so they're able to communicate with their families, among other basic services. This simply provides further information and to these individuals that are mobile moving or in this has been translated into different languages. Thank you. I would like to be very brief because the colleagues have already mentioned a very good strategies. I would like to share in a very short manner a case that could be the case of any boy, girl, or adolescent. A very simple story in which we're able to see the boys, girls, and adolescents have their first contact with us in what we call safe spaces. In these safe spaces, they share with us that these spaces have been the very first time that they're able to satisfy their basic needs, access to nutritious and healthy food. So by having this type of interaction, the children are no longer concerned of bringing or finding ways of how to fulfill these basic needs. If during this interaction we identify a behavior of concern, we are able to work directly with the children or to refer them. We identify the different type of things or that the resources that these children might need, and we refer them. For example, in Chile and Mexico, we have been able to refer the children with a psychologist, or we work directly with the psychologist that we have on site. So in these safe spaces, we're able to not only to interact, we're able to understand and provide services without having them to move to different areas because we understand that they might be exposed to further risks. This is a model that I'm presenting on with my slide that shows all of the 11 areas in which we serve. In these areas, as we mentioned before, are areas in which we provide different services through our safe areas. Now, without a doubt, I just have to say that all of the services are not provided in all of the different areas. In the southern area, we understand that the mobilization of individuals is a lot faster. On the northern area, is slower, and people stay for a longer period. So we're able to provide further services. When the routes are longer, then we're going to see a deterioration in the health of many of the individuals. With this type of service, we are able to see a great impact in the overall health of these boys, girls, and adolescents from day one. Once we are able to assist them even in obtaining their appointment in order to cross the border, we do see changes in their emotional health, their physical health. So we take pride in the services that we are providing because it's the well-being and the protection of the people that we work with. Very well, let's give a round of applause to our panelists of the day. We want to leave you with three messages. Number one, we have identified that boys and girls are not fragmented. There is no fragmentation. They will require, as it was clearly explained by the colleagues, they require an integrated response. So that invites us to not to stop planning or to not plan in silos, to find ways in how we can articulate or bring efforts or joint efforts. Another thing is that we must understand how much do other sectors know about protection and how much we know about other sectors. Without a doubt, we're not going to be the experts, but we must understand a little bit of different topics, nutrition, wash, food safety, in order to provide an assertive and a quality and integrative response. So to conclude, I'm going to ask Lavinia to come to the stage. Thank you. Thank you very much, Nettie. Thank you, panelists, for sharing all this information and the different ideas shared. Thank you for being here with us today. Thank you for sharing national perspective as well as regional perspectives. I would like to highlight a few highlights based on what Nettie just mentioned, which I believe is crucial to say. We need to talk more. We need to move the talking to the working and the coordination. I really like what Karina mentioned about working together in a multi-sectorial manner. And yes, and that is the way to go, but we also need to establish and define joint objectives or call it joint indicators. So it's working together and establishing those joint objectives and indicators. Thank you very much for your interaction. I hope the audience was able to have several takeaways from this session. And it is very important in each one of the sessions to write down those key messages, things that you can take away and apply in your region or at a local level. Thank you very much. So, with this, I conclude. Pedro? Did you have any questions in order to have a deep dive from all of the different examples that were provided? You can speak directly to Monica, Angeli, and Catalina. I have been advised that we still have some minutes, so I can take some questions from the audience. Okay, so I see a lot of hands raised. Hello, good morning. Thank you very much for your presentations and bringing very tangible examples. More than a question, I have a reflection or maybe a request. Because yesterday I was at a table in which a question was posed, and from they asked us from the different organizations that we represent here, what exactly do we need from the alliance, or what can we ask the alliance to help us? And listening to your presentations, and after the coming out from that working group from yesterday, we have a challenge before us, which is a child protection, and we need to work in an integrative way, in a multi-sectorial way. From the alliance, we can raise the voice and work with those international organizations. We always talk about what is the need, but when we do the budget and we identify the resources, many times the budgets simply restrict us from the design of the type of interventions that we're able to provide. Yes, we need to be multi-sectorial and we should work together. But what we see is that many times when we present the needs, we are many times limited. So we need to be able to create interventions that could have a different type of focus. That way we don't walk into these working tables as this is only a proposal for wash, or this is only a proposal to work with the food safety. Rather come with a package of an integrative type of initiative that serves all of the different area, call it wash, cash, or among others. That way, those individuals that are out there on the field will be able to get these resources. So yes, without a doubt, there are many challenges.
Thank you. We're going to take up to three questions then. Good morning. I'm from Guatemala. In reference to what my colleague said just now, in Guatemala, I believe we have had advances, and we're working from the design, integrating education. We have over 500 children registered in the educational system with education in emergencies, the educational route, not to interrupt their regular education during their migration process. We're working with cash transfers and also hand in hand with migration. So we get support to help them become regularized so that they can access jobs. So we're working hand in hand with the municipalities and with the public ministry for the gender issues. But a gap that I see is at the border specifically because there are a lot of overlapping services for what my colleague was saying about synergies and coordination. So how are you handling this? What do you propose? In Guatemala, we're working in clusters, and in these clusters, we're trying to complement each other. So there's not a lot of overlapping with the services, especially in the border area between Honduras and Guatemala. There's a lot of overlapping. It's like a lot of organizations are working in the same issue, and not enough shelters, and not enough health services. That's where we're trying to make advance. So in order to address the overlapping, how are you approaching this? What does Honduras propose? Something important. You mentioned the donors conditioning PRM funds from the United States, for example, not using funding for Mexican displaced. You can use those funds for the Mexican displaced. This is a community action which is very complex because they are sharing the same shelters for similar reasons. And the other one, this is from yesterday, that they need to send this to the Congress in the United States, not to use funding for fostering education, for creating a lengthy stay in the United States. So given these specific conditions, it affects Mexico, but maybe more in general, so in the region. So number one, how are your organizations approaching this? Because there are humanitarian needs, especially in Mexico, even though it's included in the Mexican context, the financing, and also the topic of sheltering and along the legal migration route. And what alternatives are you looking for providing solutions? And also, what do you think the interagency cooperation, these groups of interagency children help can be more productive in seeking common solutions to avoid duplication of efforts? How can we use jointly better facing these limitations? And what are the alternative ways facing these important limitations from the donors?
Gracias. Entonces vamos a responder con...
Thank you. Let's begin with Monica addressing these questions. Well, without a doubt, because this topic of the collaboration with donors is very important, as we have all mentioned it, because usually on the calling, you see literally the restrictions. From the Mexican case, it has not been easy. The topic of immigration has been going on for many years now. That means we have collaboration with a lot of donors, that it's the first time we have worked with them, but definitely every time we need to make a proposal, we need collaboration with our different technicians from their different sectors. We have worked really hard to create awareness so that each proposal brings the opportunity to bring on the table. So it has really been difficult. This is a success case. When you have international cooperation for development, we have been able to talk about multi-sectorial projects with comprehensive protection. And so this is not being questioned regarding the restrictions if you're doing education, for example. They have had this sensibilization working with other organizations. So we are not the only ones with the same discourse. This has been something that has worked. And now it's important how the financing portfolio is being identified, because what we cannot cover with our usual donors, which are stuck to very sectional work, we have been able to open a new discourse because they are not fully educated in the topic. So we have to put it in the agenda, how to approach this multi-sectorial work. So we get this from irrestrictive funding coming from them and not for a specific sector. And we are positioning protection as something comprehensive. And in Mexico, it has helped a lot to be able to do a lot under the umbrella of protection.
En relación al tema de optimizar, ¿verdad?
How to optimize services and care in a coordinated fashion. Specifically, reaching Honduras, we have had a process begun in 2015, strengthening
Tener como una base, ¿verdad?
protection system in Honduras, and in the territory we can do this coordination, especially in cases of infringement of rights or violence and children in a position of vulnerability. And humanitarian aid organizations also, we sit down to double check that we are fully aligned, that we have common goals for safeguarding, for example. In Guatemala, there were friendly spaces, for example, but there was not enough for all the causes. There was enough only for one. But that's the reality within this context. And what we did, so that children would be able to get care the whole time, and also they could enjoy the friendly spaces and participate. We coordinated times. For example, for a certain time, childcare would take care of this, and the Acceso Mundial would serve at another time. So we could all contribute without causing harm, among other actions that we carried out jointly to get to know our own work, being able to create references in an orderly manner so that we should all know what's going on and we can manage it. Thank you, Catalina. I only have 1 minute now. I know I want to highlight the importance of coordination to tackle duplicity, repetition, not only in clusters, that we don't only have cases in Venezuela or Colombia, but also the coordinating mechanisms at the national level, how we can effectively this objective of this coordinating group, how can visibilize what we have and also visibilize what we do not have, and how can we do a comprehensive programming with other sectors so that we can articulate not only at the national level, but also the sub-national level. And secondly, sorry, I overstepped my minute, but this is the topic now of the donors. Why, as our colleague said, and I heard this in other meeting, one of the next steps, and maybe this is for the facilitators, how can we continue talking with the different sources of financing, the different donors we have in a comprehensive planning, how to look for the well-being of children is the utmost goal. Thank you. A very strong round of applause for our panelists. I know we wanted to talk more about this, but we're going to have a break and we'll have the possibility to continue talking outside bilaterally while we're enjoying our coffee to continue talking about this topic. I do thank you one more time, all of you, each and every one of you, for being in this session. And our coffee is ready. We can step outside and enjoy our break. Thank you.